Looking back, before modern medicine, it's easy to see the progress we've made in preventing disease and treating illness. There were no antibiotics, and surgery was still in its infancy. Since then, we've eradicated many deadly diseases, and groundbreaking treatments for chronic conditions have been put into use. Today, more people than ever are benefiting from modern diagnostic tests and life-saving procedures. During this time of discovery, a hospital was established in Alabama to treat children. And through the years, it has been there for them, providing comfort and care. Now, Children's of Alabama is entering a new era and a new home, and together they will have a profound impact on the lives of children. In the early 1900s, Birmingham was booming. The bustling city hummed with growth and vitality. But amidst all the prosperity, diphtheria was pandemic, and the city's hospitals were overflowing with patients. Dr. Carl Henkel, an Episcopal minister, had been concerned about the lack of health care available to the area's children, especially those from poor families. Others shared his concern, and together they started a movement to establish a free hospital for children only. From this, the Holy Innocents Hospital Association was formed in 1911, under the auspices of the church. The following year, the hospital opened its doors in a church parish house. Within months, the group had rented a simple frame residence and equipped it with 12 beds. Among the poor, the news spread quickly, and the parents came, filling the hospital with their sick children. Along with church sponsorship, the hospital relied on the community, particularly the ladies, to keep it going. Women volunteers raised funds, scrubbed floors, and sat with sick children. In short, they managed the hospital on a day-to-day basis. One of them was a young mother who had adopted Birmingham as her home. Caroline Johnson's volunteer work would impact the lives of children in Alabama for decades to come.
She had a tradition of being involved with her family, and she believed that it was important that this city, this new city of hers, have quality health care for her family, but especially for her children. I believe that children were her passion, and so when she was looking to make a difference in this community, that's where she began.
Soon, the association raised enough money to renovate the house. Now, Holy Innocents Hospital boasted a model kitchen with a nutrition program, a laboratory, and 3 wards with enough space for 25 children. The operating room, especially equipped for youngsters, was said to be the best in the South. The following year, the association changed the name of the hospital to the Children's Hospital. In 1923, Children's gained an important new friend when it was named a beneficiary of the newly founded Community Chest. The charity, known today as the United Way, provided the hospital with much-needed financial stability. Being more firmly established, the hospital was soon able to move into an impressive new brick facility. Soon, even more space became necessary, and in 1932, a second building with an outpatient clinic, nurses' quarters, and urgently needed operating rooms was added. The dream to provide health care for children had become statewide in scope. Now, Children's had the resources and the people to make a profound difference in thousands of young lives.
When you walk in the door at Children's, it is about love. It's about nurses and doctors just wrapping their arms around these sick children and these families who are desperate to find help for their children. It's just an incredible place, and you feel it the minute you walk in the door.
The next decade would see great strides in medicine, and with the help of a new friend, Children's would keep pace. For it was during this period that it became a member of the American Hospital Association. While the women continued to raise money and run the hospital, our men entered a new fight when America went to war. Fortunately for our servicemen, thousands of lives were saved with the introduction of a new miracle drug when penicillin became available. Sadly, about the same time, there was another battle on our own soil: infantile paralysis, or polio. Even the prosperous years following the war were marred by the fear of this disease and its destructive effects on thousands of young people. One of them was a little girl from a small Alabama town.
Had I not been at the Children's Hospital in 1951, I would not be sitting here in front of you today. They saved my life because of the care that they gave. And when I had polio, it was during the epidemic, and I went in on a stretcher, and I was in an iron lung because I was paralyzed from my neck down. And the only thing I could move was my head side to side. The doctors and nurses were like family to me, and not just to me, but to the other children, because that's who we were around most of the time, because the parents couldn't stay. I don't think there's enough words for me to let them know how thankful I am for everything that they did for me, how thankful I was for the compassion that they gave me, and the care they gave me, and the love that they gave me. And I went in on a stretcher, and when I left the Children's Hospital, I was walking out on little crutches.
In 1955, victory was declared when a safe and effective vaccine was developed to prevent polio. The discovery was truly a triumph of American science and ingenuity, alleviating the concerns of millions of parents and transforming our expectations of what research could accomplish. The following years proved to be transformational for Alabama's children as well. While growing in size and scope, Children's had never lost sight of its original mission. Every child who needed help was treated. No one was turned away. However, despite a bright outlook for the future, a new problem loomed. The hospital itself was aging and out of space. So in the early 1950s, the still all-female board of directors began planning for an impressive new facility which would open its doors in 1961. That same year, Children's entered into an agreement with the University of Alabama at Birmingham to share resources, a partnership still ongoing today that helps us maintain our leadership role in pediatrics nationwide.
We are so fortunate to have Children's Hospital here in the state. It is world-class. It allows all of the children across our state to have the very best health care available. Regardless of how sick you are, Children's is there for you.
It was about this time that medical pioneers began forging ahead with unheard of techniques and groundbreaking discoveries that would impact medicine as we know it. We learned about the first liver and lung transplants, and parents were relieved to hear that vaccines for mumps and measles had been developed. The news of the first human heart transplant was truly astonishing. But even in the midst of these exciting medical developments, neonatal nurses at Children's were saddened when a newborn with badly damaged lungs came into their care, and there was simply nothing they or the doctors could do to help. That is, until they started the ECMO heart-lung bypass program for newborns.
When I was born, I was initially at another hospital. When they realized how sick I was, they had to transport me to Children's Hospital because Children's Hospital was the only hospital in this area that had the ECMO machine, which is what saved my life.
Because Children's was willing to be among the pioneering ECMO facilities in the nation, our doctors and nurses were now able to help critically ill newborns like Isatis, giving these babies the opportunity to live long and healthy lives.
The ECMO machine allowed me to oxygenate the blood outside of my body so that my lungs could heal, and it also filtered my blood.
Like so many former patients, Isatis knows the tremendous impact Children's had on her life and the challenges she would likely be facing today were it not for the care and specialized treatments she received here as an infant.
It's a blessing that I had the opportunity to have access to the ECMO machine. If it had not been for the ECMO machine, I would not be here to talk about it today.
These were exciting times. The hospital was growing and expanding throughout the state, adding pediatric practices and outpatient services right in the communities where the children lived. it was evolving from a medical center into a comprehensive pediatric health system. During this period of rapid change, advances were also being made in critical care and the crucial mission of transporting severely injured patients to Children's, the facility best equipped to provide trauma care for Alabama's youngsters.
Critical Care Transport is a group of registered nurses and respiratory therapists from Children's Hospital that travel by helicopter, jet, and ambulance to referring hospitals outside of our area and transport critically ill and injured patients back to Children's Hospital. The value and importance of our service is that we're able to provide the specialty care transport to families that are in rural Alabama that may not necessarily have the specialized pediatric care or equipment that's needed for their child.
And here at Children's, the work continues.
16-year-old female ejected.
Not just in the trauma and intensive care units, but throughout the hospital, where everyone shares a common goal.
We all have passion for the children we care for. We have a passion for doing what's right and providing the highest level of care that we can for our patients and for the patients' families. I know that each and every day that I come to work that I'm going to make a difference in not only a child's life, but in their family's life. I have realized that this is where I'm supposed to be. This is what I'm supposed to do, and that God's put me in this place for a reason, and I didn't realize that until just a few years ago, but I'm glad He did.
Today, we live in a world very different from the 1900s. But even in this age of modern medicine, the parents of sick and injured kids still rely on Children's of Alabama, the only facility in our state staffed and equipped for the special needs of children. And today, as always, love guides the way. The pediatricians, the nurses, the pediatric subspecialists, everyone works together to see that our children receive the care they need. Today, Children's is the premier pediatric health system for Alabama and neighboring states. We're ranked among the nation's top hospitals for children, with a number of our pediatric programs receiving national acclaim. But we're not resting on past accomplishments. We're searching for new ways to treat our patients and strengthen our partnerships with physician specialists, and also to expand our services.
When I think of the last 100 years, and I think of all of the children that have grown up in the state of Alabama, I wonder what it would be like had we not had a children's hospital. When I think about children's and the many reasons why people should send or bring their children to the hospital, I think of the quality of health care. I think of the passion of the doctors and the nurses who are there to take care of these kids. I think of the volunteers who give countless hours to make the experience better. It's just an incredible place, and you feel it the minute you walk in the door.
Now, as Children's celebrates its centennial, we stand poised on yet another frontier in medicine. One where new techniques and sophisticated technology promise cures for diseases that still threaten our children, as well as new therapies that may prevent devastating conditions from ever occurring. To meet the challenges of this exciting era, Children's is moving into a new facility, the Benjamin Russell Hospital for Children. A move that will make it possible to treat more patients and offer additional services. Indeed, one day in the future, to serve the needs of children whose mothers have not yet been born. The new hospital will give us advanced surgical capabilities so we can help children who need transplants, children with life-threatening liver, kidney, and heart problems. It will be family-centered, so parents can be integral to the healing process. All of the rooms have been designed to ensure the best possible care for our patients and the comfort of their families. The building itself is environmentally responsible, promoting wellness and good health for all its occupants. And, like the children entrusted to our care, the hospital will continue to grow and develop well into the future. Yes, a lot has changed since Reverend Henkel voiced his eloquent appeal for help for the children of the poor. Yet Children's remains a place of hope in the face of sickness, disease, and life-threatening injuries. And the familiar children in the red ball remind us daily of our simple calling, to use all the knowledge and tools available to us, and to use them heart and soul, to mend little kids.